Good afternoon, and welcome to Pay Entry's webinar on update on CDC guidelines for quarantine. Thanks for joining us today. My name is Cathy Graham, and I'm head of the HR services area at Pay Entry. I'm the person, or Brianna Grimes, who is my associate, are the people that you would talk to if you have an HR question. So we're here to help anytime. Let me just tell you, though, that I am not an attorney. So what I tell you today is not legal advice. It is practical advice for being an employer. So just to let you know that if you do need legal advice, we can certainly refer you to an HR attorney. But I think today what we're going to do is go over the basics. This is being recorded, so you will get a copy of the recording after the session is over. On the handouts place on your screen, there's a little box where it says handouts, 1 of 5. There is a PDF version of this presentation that you can download and scribble on or use for further reference materials. Okay, let's talk about new guidance from the CDC on quarantine. And I will tell you, if you've been to any webinars that we do at Pay Entry before, we don't spend an hour telling you all of the background and all of the nitty-gritty. We're giving you the facts. And this is just boiling it down so that you know the core of what you need to know. And then if you have other questions, we can help you with those. So my webinars will never be 45 minutes long unless they have to be for HRCI credits or CE credits. And we do have a few of those, but we tend to try to focus on the facts and make it quick for you because you don't have a lot of time to sit in front of a screen and watch a webinar, and I don't, so that's how I know you don't. So the guidance is that quarantine, and basically, let's go back and look at background. Quarantine is used to separate someone from the public or from your employer group that has COVID or that has had possible exposure to COVID. So when we talk about quarantine, we're talking about just this particular group. And that quarantine is done so that we can help prevent the spread of the disease. It's all we hear about nowadays, that and the vaccinations, which are awesome. I get my second vaccination next Saturday, and I'm really excited about that. So I'm on the bandwagon here. Okay, let's talk about this new guidance. And it might be shocking, it might not. But right now, the CDC currently recommends a quarantine period of 14 days. And most companies abide by that. But there is a quarantine for 10 days, so that quarantine for exposure can end after day 10 without testing and if no symptoms have been reported during the daily monitoring. So let me break that down. It means that if somebody goes out, they didn't have symptoms before, and they were exposed to someone, but they have still no symptoms within that 10-day time frame, then they can come back to work because the symptoms are the part that makes the disease communicable. The sneezing, the coughing, touching your face when you've sneezed and coughed and things of that nature. So if someone is exposed to someone else that had COVID, they may not get it. But so if they don't have any symptoms throughout those 10 days, then they can actually come back to work. There is a 1% risk that, or less than 1% risk that someone who comes back after 10 days having had no symptoms, according to the CDC, to give it to someone else. Quarantine can also end after day 7 of exposure if they get a negative test within 48 hours of this planned discontinuation of the quarantine. So if they have been out, they don't have any symptoms, no fever, no cough, nothing like that, and they get a test within 48 hours of that seventh day, then they can come back to work. So this is the primary stance that the CDC takes on the length of the quarantine. It depends upon what's going on. If somebody has full-blown COVID, they need to stay out for 14 days. So one of the things, since this is just a statement that's been made by the CDC, I thought I'd go into some of the questions that they get also, so that we could take a look at the answers that they give. Oh, I'm sorry, in this last little piece, the quarantine can end after day 7 if no symptoms were reported during their daily monitoring, and that is for the 7 days. So here's a question. What should you do if an employee comes to work or they get sick during the day with COVID-19 symptoms? Immediately separate them from others and send them home. Don't let them work out the rest of the day. If they have symptoms, then you need to get them out of the workplace. They should not return to work until the quarantine is over. According to the CDC, you shouldn't require employees to provide a negative test to validate their illness, qualify for sick leave, or return to work. And that says because the law does not require it. Now, I know a lot of employers that don't do it to validate their illness, but they want them to get a test to either qualify for the sick leave or return to work. It is not necessary if they have gone through that quarantine period, but employers can require them to do it, and it is not against the law. CDC is trying to keep people out of doctors' offices because they're so crowded right now in certain parts of the country, so that they want people to avoid requesting a negative test result or a test at all if the person no longer has symptoms and they've waited out their quarantine period. So another question. If employees have been exposed but they're not showing symptoms, should you allow them to work? I get that question a lot. And the answer, well, the situation is that they may have been exposed if they are in close contact with someone who's infected. Like, for example, if you have a plumbing and electrical company, they normally will go two in a truck. Let's just say one person gets COVID. Does the other person necessarily, should they be allowed to continue to work? And exposure is considered to be within 6 feet of a person for a prolonged period of time. And prolonged is actually 15 minutes or more in a 24-hour period. So you can see it's not very long. Prolonged to me would be, 3 to 4 hours, but it's 15 minutes. So definitely someone riding in a truck with another person, even if they're wearing masks, one person gets COVID, the other person needs to be considered exposed at that time. So no, if you have an exposed employee, even if they don't have symptoms, they should quarantine. Now it could be for the 10 days if they've just had exposure and not actually have the disease. But no, if for my example, using the truck drivers that ride together, both of those employees should be quarantined. One because they have COVID, the other one because they were exposed. So here's another question frequently asked. What should you do if you find out several days later after an employee worked that they had COVID? If they had it while they were working and they didn't tell you and now you find it out. Well, the CDC says that if it's been less than 7 days, clean and disinfect all areas used by the employee. And that's probably just common sense. The thing that didn't make a whole lot of sense to me is the next thing. It says if it's been more than 7 days, no additional disinfecting is necessary. I'm assuming because the germs have died. From a practical sense, I would disinfect the area regardless of how many days it had been, simply to clear my mind of any problems that might occur and the employees that work around there. But according to the CDC, because you normally do have someone clean your office weekly or areas weekly, then no additional disinfectant is necessary. You do have to inform other employees of potential exposure to COVID if they were in close contact with the person. This needs to be done very confidentially. You cannot use the person's name. You can say another employee in this area or that you've come into contact with has tested positive for COVID, and then a quarantine after that would be in order. So, when should an employee suspected or confirmed to have COVID-19 return to work? They can return to work after the full quarantine period established, and normally that would be 14 days if they um, tested positive for COVID during there and had symptoms. Um, After also being able to return to work after having consulted with a healthcare provider. But a negative COVID test is not a requirement to return to work. Many employers do require it, but it's not a requirement under CDC guidelines. Tests are a little bit easier to get nowadays than they were when this first came out, so it may not be as big a deal to have them go and get a test before they come back as it once was. Another question, should we be screening employees for COVID-19 symptoms? Well, it really depends. This is an optional strategy on the approach to keeping COVID out of the workplace. This is not a replacement for social distancing in your in your workplace. So you would still need to, if you are doing this, still practice social distancing and masking. Most employers, if they are doing any screening prior to coming to work each day, are doing the self-screening prior to coming to work. There's either a checklist that they go online and complete, or something that they know that they need to check for every morning. Um, and if someone is doing a self-screening, you would tell them to stay home if they have any symptoms of COVID. If you're screening at work, here's some consider the questions that you're going to ask that person. You would want to only focus on new or unexpected symptoms. You know, everybody has allergies. And if this is something that happens to this person every year, they get sneezy, wheezy, coughy, and it is something that they're taking medication for, then it and to them it is their allergy. In most cases, you would not screen that or focus on those types of questions. So focus on new or unexpected symptoms. Fever is the big thing. If someone has an allergy, they don't normally have fever. So fever is a predominant characteristic of the symptoms of COVID. Fever, a new cough, not a persistent cough, one they've had all year, even before COVID started. Um, So I know my sister has allergies and she coughs, and I'm embarrassed to stand beside her when she does in the grocery store or anywhere else because it looks like she might have COVID. So I kind of work my way away from her when she starts coughing. It is an allergy, but everyone looks at her like she's got the plague. Another thing is difficulty breathing. If someone is having respiratory issues, that's usually different than anything else they might come up with, and especially if it's new or unexpected. A sore throat is also a symptom that, as long as it's a new sore throat, body aches, and a big one, loss of taste or smell. That's how some people can tell they've got it if they have no other symptoms. um, I know someone who lost their taste and smell, never had any fever or body aches or anything, but tested positive for COVID. So these are the kinds of things that you would ask. Do you have any of the following this morning? Some employers are doing temperature checks at work. There are lots of rules for things like that, and they're all on the CDC website, which I will give you at the end of this presentation. Another one too that is very prominent is vomiting and diarrhea. So as an employer, what should you do? And I like to have this at the end of each of my presentations so that you have kind of a checklist of things to go through. First of all, you need to make decisions about the way you're going to handle quarantine. Are you going to use a 14-day for everyone? Are you going to use a 10-day for someone who was exposed with no symptoms throughout the time? Make decisions about how you're going to handle that. Then write a clear, concise policy. This will have to be changed as we go along because we've written policies on this for our company, and I'm getting ready to draft some new policies because coming out of the pandemic will create a different environment, and travel is loosening up for um, companies sending people on sales meetings and things of that nature. Some of that's starting to crack open, and I think by fall, um, we're supposed to have everybody that wants to be vaccinated by the end of May. So by fall, we'll have some new rules to put into place as we go along. So, but start out with a clear, concise policy. And last but not least, or not last, but communicate your policy to employees. That's very important. Use, if they're working from home, you don't have a lot of these problems because those people don't come into the office, they're not exposed, you don't have to quarantine them. They're already at home. So, but communicate your policy for those who work at home, work in the office, a little bit of both, people who travel for you, things of that nature. You need to communicate it to everyone in your company so that everybody knows the rules and who to report an illness to and all of those things. Do it in multiple ways so that if they don't see the email you send them, maybe they see the poster or some kind of a flash text that you send them. We all communicate in different ways nowadays, so whatever is the best way to communicate with your employees, and do it in multiple ways and probably 1 or 2 times so they don't miss it. And then last but not least, be prepared to answer questions. This is very important because, and tell people who to go to ask their questions. You need someone who's very informed on the policy and what how the company has positioned themselves as far as quarantines go. You need someone, one person or 2 people that can be the designated answer people for these types of questions. That could be your human resources department, or it might be the president of your company, depending on your environment. Now, if you want more information, you can go to the CDC's website, and that's cdc.gov. You can also go to the OSHA website, which has a lot about how to prevent it in the workplace, the rules and the guidelines there, especially if you offer or you operate a manufacturing facility or a facility where you do have drivers that ride together, things of that nature, different exposures. So, and if all else fails or you don't want to go to those websites, just send an email to hrservices@payentry.com, and we will be more than happy to walk you through this, your scenario, and determine what's the best approach to it. And that's the end of our webinar today. Do we have any questions? I forgot to tell you, you could type them in the questions box, but if you have any questions now, please type them in the question box. And let's see, it looks like we have. Okay, payroll guidelines, how to apply sick leave or sick pay and vacation. I think this is in California. It says CA, sick leave or sick pay or vacation. When does the CARES pay apply? CARES pay comes first. Now this CARES Act is the FFCRA. It's actually not in the CARES, it's in the FFCRA Act. The paid leave and tax credits that go along with that, 10 days, and I can send you more information on that. But that pay would come first because you get an immediate tax credit for it. So under the FFCRA, person would get up to 10 days to use. You would get an immediate tax credit by using a special code in the pay entry system. Depending on what type of leave it is, there are 3 different codes, and I can send you something on that if you would like, or you can go to our website. I think it is on our website also. Let's see if there are any other questions. Okay, it doesn't look like we have any additional questions. If you do have a question after this is over, please just email me or, oh, wait a minute, here we go. Let me, I think there are more questions. Let me just see here. Okay, here we go. So at-work screening is not required. No, at-work screening is not required. It's not a requirement. Even at-home screening is not required. None of that is. It just depends on what level of interest you have in knowing if someone that's sick is coming to work. Another good thing, someone thought the CARES Act expired. The CARES Act, actually, what we're talking about is the paid sick leave under the FFCRA was extended through March the 31st of 2021. However, it doesn't start over again. If somebody used 5 days last year in 2020, they would only get the remaining balance of 5 days. Or if they used 10 days last year, they have nothing, no break benefit left. So it is just kind of a roll into 2021, but does last until March the 31st. The difference is that in the past, the FFCRA paid sick leave was mandatory, and now it is voluntary for employers to participate or not. Okay, any other questions? If not, okay, here's another question. What happens to the paid leave after March the 31st? It's up in the air. It could come through as a part of the new stimulus package that's coming, that's in the Senate right now being voted on, or it could end. I have a feeling that it will extend, maybe not through the entire year, but partially, but that is yet to be seen. We're getting ready to do a webinar on that stimulus package as soon as it passes the Senate and is signed by the president. So make sure you keep an eye out for that one. We're also getting ready to do an update on the Employee Retention Tax Credit, ERTC. We get a ton of questions about that because there is a retroactive credit that you can get for 2020 if you, even if you had a PPP loan. So we will be posting both of those in the next couple of weeks. Another question is, if you're working remote and have COVID, can they still work while quarantined? Sure, if they feel like it. Some people who have COVID don't feel bad. And yes, as long as they're not too sick to work, they can continue to work. And that happens quite a bit now because people are remote. Even if they're quarantined, they can still work because they're not sick. If it was, especially in an exposure case, if they were only exposed, they can't come to work, but they can do their work at home. Another question, are employers prohibited from requiring proof of exposure before the CARES paid leave applies? No, you can ask. There's no rule that says you can't ask them who they were or how the exposure occurred. Most of the time, people get a notice from the health department, and you can ask for that. So I know I had talked to one employer who was requiring that because he had people who wanted to go deer hunting, and they were asking for this paid leave because they'd been exposed to someone and they just wanted to go hunting. So it does happen, everyone, once in a while you'll come across something like that. So you can require proof. Now, if it's their mother or father, yes, you can get, I'm not so sure about them sharing the actual test result paper, but if it is um, one of a family member, usually employers don't question that, but it's up to you because there's no law that says you can't. It's just a morale issue type of or morale type of issue. Okay, well, it looks like that was our last question. So thank you very much for attending today. Remember, you will get a copy of this handout, and there's also a recording that will be posted on our website tomorrow, but you'll get a copy of it in your email. Thank you for attending, and we look forward to seeing you next week on our weekly webinar series.